Hi there, it's Judith and Desjardins. I am at the oncology clinic today because I'm very nervous about the port that was installed. I don't really understand it. It's like an alien thing that's in my body that is very pronounced. This big bulb port is sticking out on my skinny chest, and I have this other line where I have this little line going up here to where they tap into a major artery for the infusion. I didn't really get great directions in terms of taking off the bandages for this port or knowing if it's working well. I called my sweet nurse practitioner and asked if I could come in for a brief visit today to quell my anxiety and for them to remove the bandages and tell me if everything is right. I have a skinny upper chest, and she told me in a text this morning that yes, it does protrude above the skin line in thin people. So I'm a firm believer in coming to the doctor and telling them what's happening emotionally so that the anxiety is reduced and I know what's going on. To the doctors and nursing staff, they see ports all the time and it's no big deal. But if you've never had one, for me, it is a big deal. I never had this. I've had surgery, ablations, cryoblations, 8 rounds of Gemsar, chemotherapy, and it was all predictable. But this is something new, and it's normal to have anxiety with new things, especially when there's so much riding on it. I can get used to the port. I just want to know that it's functioning well and that I will be ready to have my first infusion of this secondary chemotherapy next week. So this is what the life of living with cancer long-term looks like. And I know that I'm in excellent care, and they made special space for me, so I'm grateful. I send my love to anybody who's recently had a port installed. It's a weird experience. And so as a holistic psychotherapist and cancer advocate, I believe in really honoring your body, mind, emotion, and spirit. I'm relieved that my weight has held steady at 122, even though I've had really food intolerance, nausea, haven't felt like eating. A lot of things don't taste the same. I've been experimenting with making different soups. What my body seems to enjoy is sashimi, tuna, papaya, cheese-covered grits, but a lot of things I normally eat have not been tasting good, so I'm scrambling to find out what I can do, add to my diet, experiment with some things that I haven't eaten in a long time, and see if I can just keep myself beefed up for this new experience. So just talking to you today has made me feel better and less frightened. I think I can even take off my hat, plump up my hair. I think it's important to share with other cancer patients that we all go through these feelings and fears with the unknown. And so I'm making this video for me, but I'm also making it for you. I have lived through many awkward things with cancer, and this is just another step. But it's wonderful to have loving assurance and a helpful care team. So thank you. Thank you for being with me. My blood pressure was 150 something when I came in, and I'm sure it's much lower. Just to have myself talking, not in a hyper fight, flight, immobilization, freeze response, and just advocating for myself, loving my body for having this protruding button that will administer the chemotherapy without harming the veins in my arms. I chose this, but it's scary, and thank you for being with me. I love you. Send encouragement, hope, strength, resilience to all cancer patients and their families around the world. Thank you.